Welcome to IRG's Sports Medicine Update. I'm Tom Hutler, along with Shannon O'Kelley, physical therapist and president of Integrated Rehabilitation Group, and our guest, Dr. Mike Williams, endocrinologist from the Polyclinic.
Dr. Williams, thanks for joining us again. You were here before, and before we talked about hyperthyroidism, and we learned so much. If you have hyperthyroidism, there's got to be something opposite of that, and that's hypothyroidism. But before we get started on that, again, you're at the Polyclinic, you're an endocrinologist. Can you tell us and those folks listening, how do you become an endocrinologist?
Endocrinologist is a medical specialty, so we train through medical school and some post-medical school training like other physicians. And our expertise is in treating hormonal disorders. Hormones are chemicals that circulate in the blood and do important work around the body.
And one of those glands that we have in our body is the thyroid gland, and it's responsible for kind of releasing those hormones that regulate certain things in our body, and that's what we're going to talk about. Like I said, last time we talked about hyperthyroidism, and this time we want to talk about hypothyroidism. And so talk about hypothyroidism.
Hypothyroidism in general is a lot more commonly encountered than hyperthyroidism. Hypo, which means low or under, means that the thyroid is not producing enough hormones to meet your body's needs. And because thyroid hormone is one of many features that dictate your metabolism, people with a low thyroid or underactive thyroid can experience fatigue, tiredness, cold sensations, dry skin, brittle hair, often excessive weight gain.
Excessive weight gain. So, if you're just all of a sudden gaining weight out of the blue, that could be because your thyroid is not producing that hormone and your body's just not burning fuel?
It is certainly possible, though if you poll a certain segment of the population, you'll find a large percentage of people who are tired and gaining weight certainly have those symptoms. Not all of them are attributable to thyroid, however, so it's important to rely on lab work to make the diagnosis.
And that's a good point. So you talk about symptoms and this lab work. Again, there's specific blood work that if you have those symptoms, your physician should be requesting?
Right. Thyroid hormones can easily be measured in the lab, and in cases where there's a medical situation that's suspicious for either too much or too little thyroid hormone, healthcare providers can easily order blood work to determine whether the thyroid is functioning just right, too high, or too low. And
one of the things I'm thinking about as you're talking is, people with possibly depression. Depression, being that they're just kind of lethargic, they don't want to do much, they don't want to get out of bed, they seem tired. Can this get confusing sometimes?
It absolutely can, and I've seen people who have gone many weeks or months with symptoms like fatigue or depression who finally get their thyroid hormone checked and find that they're underactive. And in cases where a difficult problem like depression is present, we're always very happy to find an underactive thyroid because that's an easy fix. We can definitely treat that medically without too much trouble.
Is it more common to see hyper or hypothyroidism?
Hypothyroidism is far more common than hyperthyroidism. Like many cases of hyperthyroidism, hypothyroidism is almost always related to a malfunction of the immune system. We call that Hashimoto's thyroiditis, a situation where the immune system gets a little confused and tries to attack the thyroid gland, thinking that it's a foreign invader in your body and needs to be killed. That ongoing onslaught of the immune system on the thyroid often, but not always, leads to lower and lower thyroid hormone levels over time.
We talked about hyperthyroidism. We talked about gender. Females having a little bit more incident of this. And is that still the case with hypothyroidism?
It definitely is. We see many more cases of hypothyroidism among women. Men are certainly not immune, however, especially if there's a strong family history of other relatives with thyroid problems.
Is there any kind of age range where, I have teenagers and it seems like, they're always tired and is there any kind of age range where this kind of occurs or is more prominent?
Not really. The more common times to start seeing people develop hypothyroidism would be maybe the late teens or early 20s. It can develop in children as well, though that's less common. I see people newly diagnosed with hypothyroidism in all points of the age spectrum, though. People in their 80s and 90s have come to me with newly diagnosed hypothyroidism.
So, being an endocrinologist, that's a fairly specific specialty. How would people get to your office? Is that usually a referral process?
We almost always receive people to our clinic as a referral from their primary care provider. So for anyone who is suspecting a thyroid problem, such as otherwise unexplained fatigue, tiredness, weight gain, first stop would be primary care doctor to get thyroid levels checked. And if there's a thyroid abnormality, in many cases, primary care providers are able to address those directly. In other not so straightforward cases, they're referred up to an endocrinologist for us to help sort out the reason for the problem and identify the right steps to treatment.
And what would a patient experience at your office? I mean, how would you start the evaluation process?
We typically rely on blood work, as I've mentioned before, to determine how the thyroid hormones are being produced, whether within the normal range, too high or too low. Often, in especially cases of hyperthyroidism, there are other lab tests that need to be determined to start figuring out the reason. Occasionally, we'll utilize some imaging tests like thyroid ultrasounds or thyroid scans to determine the particular reason for a hormonal abnormality.
Gosh, this is all so interesting. I mean, besides thyroid problems, I mean, being an endocrinologist, I mean, what kind of diseases? I mean, kind of a summary. I'm sure you see diabetes, and what other things do you see in your practice?
A large proportion of patients that an endocrinologist will see would include diabetes. Diabetes is considered a hormonal disorder because it in large part relies on insulin, a hormone that helps regulate blood glucose levels. We also treat problems of hormone-producing glands like adrenal glands that sit above your kidneys and produce steroids, and also the pituitary gland, an important little gland that sits below your brain and produces lots of hormones that have lots of different effects around your body.
And so, I mean, you're obviously, quite educated in all these hormones and these glands in our body. How'd you get interested in that? I mean, do you go to medical school and then go internal medicine? What was the route you take to become an endocrinologist?
Well, that was the precise route I took. I went through medical school, began my training in general internal medicine, and I discovered while training as a general internist that I really enjoyed the detective work that comes with endocrinology. There's a lot of lab testing to do, a lot of mystery solving and problem solving, and often we have to put clues together to figure out exactly what's going on. Another thing I enjoy about endocrinology is that when we treat people for things like diabetes and thyroid disease, these are long-term chronic illnesses that require usually years and years of ongoing treatment. And I really enjoy the relationships I get to build with my patients as we treat for months and years at a time. Also, endocrinology is a generally pretty happy specialty. Diabetes and thyroid are very treatable, and so I have the reward of getting to see people do really well.
Wow, that's great information. Hey, real quick as we close up, I'm just curious. We talked about hyperthyroidism. Now we're talking about hypo. Is there any problem if these things go untreated?
There can be health consequences, especially of hyperthyroidism if it goes untreated. Hyperthyroidism that isn't detected for months and years, especially if it's severe, can cause problems with heart muscle and heart rhythm, and can also weaken bone density. So in cases where we suspect hyperthyroidism, for many reasons, it's important to get that detected and treated so as not to lead to a health consequence down the road.
Well, once again, great information. We'll definitely have to have you back, and thanks for coming back again.
My pleasure. Thanks for having me.
If you would like more information on this topic, as well as how to contact Dr. Mike Williams, go to polyclinic.com or go to Integrated Rehabilitation Group's Facebook page.